Hello and welcome to our video on anesthetic considerations for patients with a history of neurological disorders. The management of anesthesia for patients with neurological disorders can be complex and requires a thorough understanding of the patient's condition and the effects of anesthesia on the nervous system. In this video, we will discuss the challenges of managing anesthesia in patients with a history of neurological disorders and the best practices for preoperative assessment, anesthesia management, and postoperative care. Preoperative assessment. Before any surgical procedure, a comprehensive preoperative assessment of the patient's neurological condition is crucial. This includes evaluating the patient's medical history, previous surgeries, and medications, as well as any neurological deficits and symptoms. It is important to assess the patient's risk of developing complications such as seizures, stroke, and cognitive dysfunction during and after surgery. Anesthesia management. During the surgical procedure, it is essential to carefully manage anesthesia to ensure patient safety and optimal surgical outcomes. Anesthesia management for patients with neurological disorders may involve using specific anesthetic agents and techniques to minimize the risk of adverse effects on the nervous system. The anesthesiologist will work closely with the surgical team to monitor the patient's vital signs and neurological status throughout the procedure. Postoperative care. After the surgical procedure, it is important to continue monitoring the patient's neurological function and managing any complications that may arise. This may include managing pain, preventing infections, and addressing any changes in the patient's neurological status. The patient's medication regimen may need to be adjusted to minimize the risk of adverse effects and ensure optimal recovery. In conclusion, managing anesthesia for patients with a history of neurological disorders requires a specialized approach and careful attention to the patient's individual needs. With proper preoperative assessment, anesthesia management, and postoperative care, patients can receive safe and effective anesthesia during surgical procedures. We hope that you found this video informative and helpful. Thanks for watching.